Hey, good evening, everybody. Welcome to another episode of Mondays with Maishi. Can't believe we're doing this again. It is May 26th, 2025, and we have a very special guest tonight, something a bit different than what we've done in the past. And whenever it's different, I make a big to-do about it, and I announce it because it's always exciting to do something different. And this time it's a sort of synthesis. We have Temimah Zucker, who is an LCSW, licensed clinical social worker in New Jersey, out of New Jersey, but really working virtual with the eating disorder population. So if you might know somebody who is struggling with an eating disorder, or maybe the parent of someone struggling with an eating disorder, Temimah Zucker is definitely a person to reach out to with both personal and professional experience, which we'll get to hear more about tonight. I'm going to ask everybody to please bear in mind that tonight's discussion on eating disorders, or maybe more specifically anorexia, or maybe just general eating disorders, we'll find out, to please just bear in mind that this is a story that is a personal story. So questions should be directed as such, bearing in mind that this is something that's personal and was a painful experience, while at the same time also has a professional perspective, presumably a professional, maybe biased, but hopefully not too biased, perspective on it. So let's just bear that in mind, that the questions you're asking, you're talking to somebody who actually suffered or struggled with the eating disorder, and not just someone who's looking at it as an outsider, so to say, from a clinical perspective. So if you can please just respect that when asking questions, then please ask questions and comment. Okay. So Temimah, thank you very much for agreeing to do this. I find it to be bold and courageous on your end. You're just like, whatever.
I've been speaking about it for a long time now, so I think I'm sort of desensitized to it in a way.
So I'm not desensitized. I'm still in the throes of my overeating disorder and can't seem to shake it. But Tamima, tell us a little bit about who you are, your practice, where did you go to school, what's your credentials? And usually the question I ask, obviously, is how did you get into treating eating disorders?
Sure. So Temimah Zucker, thank you for having me, Moshi. I'm really excited. I went to the Wertheiler School of Social Work, where at that point already, actually, I knew that I wanted to work in this field. I remember my first day of grad school, the professor said, "No one knows when they're a kid they want to be a social worker," and I did. I always knew that. I didn't know necessarily the population. And I worked at an eating disorder treatment center called Montanito. It's a national franchise, if you will. It's the best term I can think of. But I worked at the Manhattan location actually when we first opened in 2013 for 7 years. I started off as a volunteer and then intern. And when I left, I was the assistant clinical director. So I worked really hard and sort of moved through. And then I started working in private practice in 2017 and opened my own private practice. I think it was 2022. And I'm licensed in New York, New Jersey, South Carolina, and Connecticut, which I know sound very random. And I work exclusively virtually, and I mostly work with folks who struggle with eating disorders. I do parent coaching, sometimes body image or disordered eating, since there is that distinction, and general mental health, if you will. But really, my specialty is eating disorders. I think that's what people are looking for when they reach out to me. Did I miss anything?
Oh yeah, you said that those sound very random, but truth be told, if you could get licensed in New Jersey, you can get licensed anywhere, frankly.
It's
Rest of this field. So it's not that random. Um, and of course, if you can turn on your videos, we'd love to see you for real. Okay. So so that's a real background, a real history, and somehow you knew you were going to be treating this population. Was that because of the early challenges that you had, or was that did that pre?
Oh, yeah, no. So I thought I wanted to work with kids actually when I was younger. And then between college and grad school, I worked as like a sub and I realized I did not want to work with kids at that point. So I chose this specialty after my own struggle. However, and I always tell this to people who are thinking about going into something that they've struggled with, I really took the time to see if I actually wanted to and could, in the sense that I needed to obviously separate what I went through from the work. And I have known some folks who they just couldn't, they couldn't take themselves out of it. And so I started off by volunteering at the National Eating Disorder Association when they first moved to New York, and realized that I actually enjoyed the work, if you will. And so then when I went to grad school, I knew that was my specialty, and it happened to be I was already working at Montanito, and so my school actually said, "Great, we'll support you with this. Why don't you do your internship there?" I know some schools are very opposed to that, but I did, and so then I fell even more in love with again the work. But definitely the seed was planted based on my own history.
Amazing. So first of all, I just want to acknowledge and commend that. The fact that you recognized prior to going into the work that you have to be able to step into a space of identification and not over-identification. And that's something that, so many of us wounded healers struggle with because we want to help because we don't want to see people experiencing the pain that we've been through. Yet at the same time, it's really a conflict because sometimes if you don't over-identify and you only identify, it's like, meh, maybe I don't want to do this work anymore. Like, why do I want to sit and listen to people's problems all day? Right? This is Alice Miller's argument, right? She says in the beginning of her book, in The Drama of the Gifted Child, she
Mm.
makes that argument like, who in heaven's name would want to sit and listen to people's horror stories and challenges and problems if not for somebody who was familiar with
Totally.
making people feel, but making their mothers feel better, right, all the time. So that balance, from when we step over from over identifying to identifying could also, as healthy and important as it is, it also risks us not being interested in doing the work as much with other people.
Well, it's interesting because I really was trained at Montanito. Like that's where I got so much of my clinical training. And Carolyn Costin, who started Montanito, is I really believe from everything I've seen, one of the first women professionals in the field to say, I went through this and I'm declaring that openly, as opposed to concealing it. And anyone who works in this field, her perspective was you should be using that. It shouldn't be something, not that anyone had to disclose, but if you felt comfortable and you had the training and the supervision to learn how to do that, she really firmly believed that that was an important part of the therapeutic alliance, specifically with eating disorders, because of how misunderstood and confusing they can be. So I went into it really being open that I had gone through it, and again, obviously learning what the boundaries are and within myself and in the room with clients, but that was always my understanding of what should happen, if you will.
Okay, fabulous. So let's jump in, like I always say, to the meat and potatoes a bit.
Sure.
Tamima, tell us just first of all, can you dispel one or two myths about eating disorders?
Oh, I would love to. Okay. The first major myth people or misconception that people have are that it's real like you can spot an eating disorder. You can tell if someone is struggling based on how they look. And I've seen that really like horrifically happen where even when I worked at a treatment center and we once had to call emergency services for something and the police officer even said like, "Oh, what is this place?" And we said it's an eating disorder treatment center and he said, "Well, this person doesn't look like they have an eating disorder," that we had called them for support with. So the main thing I think is that people assume eating disorders are one type, one look, and I said this to you, Maishi, earlier, that people assume the most prevalent eating disorder is anorexia, which is actually the least prevalent eating disorder.
I'm gonna
That's two.
put that out as a poll question to see what people would say.
Yeah,
I
it's a.
was I
I
was
know
quite
it's true.
surprised to hear that.
I do that when I speak in a school. I'll say like, "What do you think is the most common?" And that's the first answer everyone gives because it's the one that we know. It's in the media a
I think
lot.
it's
It
'cause
gets
I think it's because it has the coolest name, anorexia. That's like a funky name.
perhaps.
But what's the difference between anorexia and anorexia nervosa to me?
So anorexia nervosa is when it is a mental health eating disorder. Anorexia itself can just refer to when someone really like loses their appetite, which can be part of even a medical diagnosis at times. So we always want the nervosa when we're talking about the context of eating disorders.
We do want because that means it's a mental disorder. That's what you're saying.
Yes. Yeah. Yeah.
So, and my understanding is that's what you were struggling with at the time.
Yes. And I always, so this is where whenever I speak about my own history, which I'm very comfortable doing, it's hard to separate now the clinical side because that's when I think of eating disorders, and I'm really grateful for this. I don't think of myself anymore. It's been, first of all, many years, and I can obviously go right back into telling my story, but
Mhm.
I really think about my work as opposed to the first association being myself. But yes, so I always say, while that was my struggle, and I'm going to answer questions about my history, and this likely will be obvious to most folks on here that by no means should imply that's everyone's struggle or that this is anyone else's story. But yes,
Okay.
that was mine.
Yeah, actually, I'm hoping that we can cover some of your story as well as like what you've seen, what
Great.
you know as treatment and what you've seen in the therapy room or virtual room or whatever you want to
Great.
call it. Okay, so can you give us a little history? Give us a little part of the story. I mean, what stage of life are we talking about? When did this start? How did it start? Was there a story or stories or a theme behind it?
Absolutely. Yeah. So it was, my years of, I would say, adolescence. And I always like to say that the development of an eating disorder, and like many, struggles, is like a staircase, so it's not that something happened overnight and then I had an eating disorder. It's that there are many factors, which can include, genetics, temperament, difficult life situations that all kind of build up over time. And my diagnosis came when I can give you sort of more exact information when I started college, which I think, for a lot of people, life transitions are what trigger this struggle. And everyone who knows me well knows that Peter Pan has always been my favorite story. And so it's honestly almost like a textbook situation in terms of this fear of growing up was a big part of what I learned with therapy, my underlying issue, if you will. And so there were definitely things along the way in terms of that staircase, like I referenced to. So that includes things like I'm a youngest child, and so I was sort of had the narrative, I think, that I was getting the short end of the stick in terms of, attention and things like that. And witnessing things that my siblings went through, both amazing achievements and also struggles, or struggle, not struggles, but like my medical situations, and feeling like I was sort of alone and different social situations, also middle school. Like they're just things that I like to say are very like kind of classic things that people go through. Nothing happened to me that was like, oh my gosh, we can point to this. This explains it all. No, really wasn't like that. It's stuff that someone else could go through and come out unscathed or, feel like that's part of life. So social stuff that happened, a best friend of many, many years, like really betraying me. But I would say it all came to a head when I started college. I did not go to seminary for the year. It just didn't feel like it was the right decision for me, which in a way I'm really glad because I don't know what would have happened if I had. I went to school in the tri-state area. I grew up in New Jersey, and it definitely was not something I was conscious that I was doing, if that makes sense. And that's really the denial aspect of an eating disorder. So it's not like I woke up and was like, oh, I'm going to go have an eating disorder today. I don't even think I knew that much about eating disorders. It was really more of I feel like I'm holding on white knuckling life right now in terms of existential thoughts and all these expectations and people moving forward in life and growing up. And it came to a head in terms of using and manipulating food and exercise as a means of coping.
Okay, so if it's okay for us to unpack that a little bit.
Sure.
I want to understand. I'd love to sort of live through the mind, of someone who was struggling. The
Yeah.
words you used were white knuckling life,
Yeah.
and just put us through the experience of what it is, the intensity of the feelings. I get that you're saying there was no like specific pinpoint incident or ongoing abuse or neglect, but there was a persistent uh, um, experience or sensation of aloneness or loneliness or not enough input or something to that extent. And you're trying to cope through life and push yourself forward with that feeling of loneliness. Or am I getting that about right?
Yeah.
Okay, I'm
Yeah.
trying to
Absolutely.
paraphrase how I understood this.
Yeah.
And somehow that turns itself into an eating disorder. Explain that transition.
Sure. So, and again, this is something that I learned through therapy and treatment. I think what it came down to was I've always been, first of all, very spongy, very sensitive, all the things that I think many of us can relate to, and I've seen, in folks we work with. And I've always been afraid of dying. I feel like I understood death in the way that one can at a young age, and understood that it meant that like that was it. You die and you're gone. And I think I've had a fear of death for a very long time. And life transitions in my mind were synonymous, like we're getting closer here, kind of a thing. And we're moving on in life. And you're not a kid anymore, when you graduate high school and you go off into the world, going to college, thinking about marriage, like all life stages changing. To me, subconsciously, it triggered, oh my gosh, we're getting closer to dying here. You're not going to be a child anymore. How do we hold on to childhood? And so I mean, people have called eating disorder, especially anorexia, Peter Pan syndrome, and people actually, there's a really interesting biography on J.M. Barrie, who wrote Peter Pan, where many people believe he had an eating disorder. Like it's really so it's very, again, like textbook here for me, that I think I was so afraid of growing up and what that meant that I was doing anything I could to halt that stage. And that turned me into a child in a lot of ways. Put aside potentially, how I looked, and I'm gonna just make a small note here. You asked for other misconceptions. There's a huge misconception that anorexia means someone is thin. That is completely untrue. Many people struggle with anorexia and their body. I never like to use the word like looks normal, because what is normal? Everybody is very different. So we're putting aside even the how I looked, but if we think about it, I needed a lot of supervision. I needed, my parents, and I'm very grateful for them, were had to be very involved, and I mean, I was lucky that they were. There are many people who have no supports or, that kind of a thing. But I needed someone to take care of me, essentially, because of how I was barely functioning. Like a child, and have my meal supervised like a child. And so, again, not knowing it at the time, but the way that I had coped with this fear of growing up was by almost trying to say, I'm not going to grow up, which denied the rational aspect of, but you're still getting older, Temimah, that's not changing.
Mhm.
And eating disorders are extremely irrational, so you can't reason with them.
Mm.
So, that I think, without knowing it, is really what I was doing as
So
a means.
let me
Yeah.
see, make sure I understand again, to paraphrase this, because this
Yeah.
is very poignant. Uh, I think what you're saying is that your terror of growing up, which meant to you getting closer to death, which was terrifying, compelled you to remain a child. And so you began to act in ways that would force people to keep you as their child. In this particular case, it was your parents watching your meals, supervising you, forcing yourself into child state, and
Mhm.
whatever that comes along with. I'm just curious, are there other symptoms outside the eating disorder that, if looking back in hindsight, that you would identify as having been childish kinds of behaviors?
No, interestingly, like and as you were repeating it back, I was thinking like it's really it is. I still unpack this. It's interesting because yeah, it wasn't like I was going to use a like a tantruming or refute like there was real that it was the eating disorder. I went to school. I was doing kind of what I needed to somehow I don't know how I maintained that, but I did but it was really with the food
Mhm.
piece. And I think also, people often use the word control a lot with eating disorders. I think it's a cop out. I have to be honest. I think that it's kind of like saying people go through something when they're stressed. Like, yes, sure, but what does that mean? And so whenever especially clients will use the word control, I'm like, hold on, what does that mean to you? Explain that word to me, kind of a thing. Because there's this idea that you're trying to get control over something in your life and you can't, and so you control the food, which is still true here, but I think it's way
Yeah, I
too.
was going to say, is it essentially you were trying to control that you don't become an adult and you stay a child so that you don't get closer to death. And
Yes.
you used, okay, but you used food, you gave one example of how you used food, let's say, to have your meals supervised and sort of say your parents, your primary caregiver, your mommy's still taking care of you. Were there other aspects to the food aspect besides having people on top of you and taking care of you?
Yes. So, uh, and I literally actually mentioned this to someone in my family like a week ago. As a kid, the sort of tagline was my brother was and is brilliant. My sister also very, very smart and very creative. Like that was her thing. And Tamima was so skinny. That was like what people would say.
Mhm.
Um, so
Your
identity
identity.
was a big piece. And by the way, not because I was, trying to be like it was really just sort of one of those like genetics kind of situations. So there was definitely an aspect of, okay, I'm embarking in the world, trying to figure out who I am as I am growing up. I don't really feel like there's much about me that's too special here. So what's the thing that I do know to be true about me, and
I
how do I
know
maintain that?
about myself that I'm thin. I mean, I'm just thinking as you're saying, like, imagine if you would have become heavy at the time, and then you wouldn't be you anymore. You
So
wouldn't.
that's, I mean, one of those, DSM, fear of gaining weight, right? Like that's absolutely felt terrifying to me because as you're saying, well then who will I be? Because I don't feel like I know who I am on the inside, but I know who I am on the outside. And so I think of the body almost like a transitional vessel. I don't say object because that feels very inappropriate to call the body an object, but a transitional vessel. So if I can at least feel familiar to myself as I go through these changes, then I can hold on to something and feel a sense of comfort and safety. But if I'm also changing on the outside, when I don't quite know what's going on the inside, and when I'm getting closer to getting older, and I am getting older, what's left?
I see. So it's like the kid in the class who becomes the class clown and then has to adopt that identity and that sort of sticks with them forever because if they let go of that, I actually have a client who recently told me that he's struggling with depression and his depression let up a little bit and then he's like, now I just feel so empty because like, what do I do the whole day if I'm not depressed?
Totally.
Okay. Chana, go ahead. Let's hear.
Okay, it's fine. Okay. Yeah, as you were talking, I actually wanted to ask you, I hope it's not going to be an intrusive question. Um, when you were struggling to, like, when you were struggling with the things that you have to be responsible for as you get older and grow up,
Mhm.
would you, looking back, would you say you were kind of like doing them mechanically, doing them externally, or were the things that you were doing, or say going to school or getting your homework done or whatever, coming from the inside out? Was I get a sense in the way you explain things, pretty much what you did say, that you didn't have a sense internally of who you were, or a sense of resourcefulness and agency coming from within. Is that correct?
I think that it existed more than I realized at the time. But yes, I would say much of it felt external in terms of this is just what one does, kind of a thing. And one of the biggest threats was when I was told you can't continue at school if this continues. And it's hard to say, was that because and that felt threatening. Was it hard to say, was it because I want to be at school? Or is it because, well, I'm supposed to be at school right now? That's like the life stage I'm in. And I think it was a mix of both, to be honest. I value learning. I love learning. Most of my family's in education, so I think that there was a part of me that was like, I don't want to give up school. This is important. But I think a bigger part of me at the time was sort of like, well, then really, what am I if I'm not a student right now, which is what I'm supposed to be? But then again, the secondary gain of my eating disorder was that I ended up taking a medical leave from school, which I think, again, without realizing it, a part of me didn't want to be in college at the time. I felt like I wasn't ready for it. So I think it was a very much the different parts had different perspectives on it. But I always tell people like if I had just said to my parents, I don't want to go to college right now, I think I want to take a year off, happens to be I should ask them. I wonder. I feel like they're really supportive. They may have said like, well, what's going on, but okay. But it's much more powerful when a doctor says to parents, hey, your daughter can't be in school right now. And then it feels like I can be angry at someone else. And also, I don't have to face what that means if I'm choosing to do that myself. And so that's where an eating disorder brings these secondary gains in almost this backward way.
Okay, a follow-up question, if I may.
Of course.
Um, what you're describing, what I'm hearing, the external. the internal that you can't quite get a hold of, but you know is there. Uh, the need to identify through what you do or your stage in life rather than having a self-concept. You must have been living with enormous anxiety. Am I right?
Yes, and I don't even think I knew it at the time. Uh,
Uh,
First of all, I think that I was and from I think young teen years struggled with more depressive symptoms, and I remember talking about this with a colleague. My anxiety manifested more as being stuck in my head than I think what I thought anxiety was at the time.
that's so obvious in a sense because that keeps you here rather than facing the overwhelming anxiety provoking challenge of out
Yeah.
there.
Yep.
Right, I got
Yeah.
it.
But I think at the time I also thought anxiety meant like racing heart and like your shit and that.
The external, the physical, yeah.
Yep. Yep.
I
Exactly.
got it. Yeah. Thank you for sharing that.
Of
Okay.
course. Thank you for asking.
Those of you who are asking questions in the chat box, I would encourage you to just raise your hand using the React tab on the bottom of the screen, and we'll take your questions. Temimah, you described um, pretty vividly, the experience itself of what's going on internally
Mm,
as you struggle. And this is for many years. I'm imagining this is going on for many years. You said from early teenage through, the beginning of college. Tell us a little bit on a day-to-day basis what that meant. I mean, were you not eating?
mm,
Were you eating grass? Were you eating
mm.
tree bark? What was the internal? Did you grapple and struggle with it, or was it just like food's not for me? Like, just
Yeah.
describe that to us.
So I'm not going to share specifics in terms of what I ate or didn't eat,
Okay.
just like I never do, just because I don't think it's A, I'm one person, and B, I don't like to teach someone how to, how to struggle with this. I would say though, I will say this, in high school, I think that really in high school, it was more that the emotional building blocks were there. The symptoms came out more like almost like the moment I started college, although in high school, I think there were times that my eating was like, and I say this playfully to myself, like weird, but it wasn't like, oh, this is an eating disorder by any means. Um, it was very much like like full force when it started in terms of my habits changing very, very, very drastically. I will say that. And I to answer a part of your question, it didn't feel like an internal struggle. Should I, shouldn't I? It felt like this is just what I do. Like this, and I'm not everyone. So there are definitely some people who almost like need to convince themselves to engage in a behavior in some ways. And we use that for CBT, in terms of a dialogue and all of that. For me, it was like, there's no other way. This is what I'm doing. And again, it wasn't even necessarily that I had a conscious thought of like, if I do this, then I'll stay small. It was more of just like, I don't want to be engaging with food the same way. I have no interest. And I think for that reason, actually, one provider I worked with at one point was sort of like, are we sure this is not just a depressive symptom, that you're feeling depressed and so your food has changed, but there would over not even that long of a time, there definitely was that fear of weight gain that was extreme, as it happens in an eating disorder. Um, so yeah, I'm not going to go into too much detail about it, but I will also say that even though it felt like this is just what I'm doing, it was hours of my day thinking about food or like what the next meal was going to be. Even if I was like I know what I'm doing, there was so much energy spent, which on the one hand comes from restriction. When people restrict, they think more about food. When you're hungry, you think about food more, kind of a thing. But part of it also is just that you're spending hours a day engaging with your eating disorder brain. Hours a day, if not most of the day.
Obsession.
Say it again.
It sounds like an obsession.
Very much. To the point where I like had nothing else to talk about or think about.
It became your life and your identity.
100%.
It was the team you followed,
Yeah.
right? It was your sports team that you followed. Okay. And what was I going to ask you about that? Oh, okay. The thoughts of nutrition, did they come up? Did you worry about like, am I overdoing this, underdoing this? Is it enough? Am I getting enough? Is it just enough so that I could get by? Or was that not a thought at all?
Never. No, for me, again, I know I'm going to sound like a broken record, but I always want to be so clear about that. For me, not at all. The denial, so there, according to some, there are 10 phases of recovery, and the first one is denial. And I like to tell people that one people can hop back into unit when they're at 9, because the denial is so strong in terms of the seriousness of it, whether or not there are medical complications, just how much of someone's life it eats away at. And I did, again, one person here, but I did have medical complications that came up. And even then, totally in denial. Like, did not, I was like, the lab work is wrong. It's someone else's lab work. You guys are all overreacting. This is not a big deal, which is the most common thing. And again, it's an irrational struggle. So people around me were like, what? Where's your brain? I just didn't care.
Wow. Okay, let's take a question from Mickey. Go ahead, Mickey.
So, how did you come to a point of getting help? Did someone notice things, or did you confide in someone about like this challenge that you were going through? Like, when did it come to that point?
Yeah, it's a great question. I, so my parents were seeing me on the weekends, and truly, again, put aside were there changes to my body, all of that, because by the way, again, some people, their bodies do not change even when they're engaging in behaviors. They noticed that I was just becoming a ghost of a person, and they were just started school, and they were kind of like, okay, what's going on there? There's a problem here. Um, and I think they then saw
That, by
my
the way, that's just so incredible to hear because you look so vibrant right now, so alive and vibrant that it's hard to even imagine that.
it's really my mom randomly will be like, remember that year you smiled 3 times in total? And I'm like, I do not actually. But yes, it's very much a very different situation. Thank God. Um, I actually was seeing a therapist already at the time, just starting in high school to cope with loss with my grandmother's death. Remember, death, big problem for me. And I will say that there was also a very difficult, bordering on emotional abuse, like a boyfriend situation that came up in high school too. So I was seeing a therapist, and my parents noticed that my eating habits were also just different, and that I was more secretive, and a lot of things. And this is telling this scenario. So my dad, I'm very close with my dad, and he's very much who he is. He's a very like he does what he needs to do the right thing, kind of a person. And I think he would always take me to therapy, like drop me off, and he came into the session. It's telling that I let him. That's my point, right? I could have said, you can't come in, but it's telling. So there definitely also was another part of me that I think I was not very connected to it, but crying out for help, in some way, but really not connected to it outwardly. And he said to my therapist, we're really concerned about Temimah. She is a ghost of herself. Her eating habits have totally changed in a way that, and my parents are both educators, and he's worked in high schools, and he knows what eating disorders are. And he was like, we think we know what's going on. And my therapist, tip to everyone here, never do this. My therapist said, it's a phase. Just let it be. And my dad, being who he is, was like, thanks so much. We're gonna go. He was like, no, he knew that's the wrong thing to do. And I was just like, whatever, like couldn't really care either way. And they from there, I think like took me for an assessment somewhere, and I was like, nope, not doing any of these things. Like, I refuse. You're all blowing this out of proportion. There's no problem. And very painful memories that my parents, without knowing it, were almost like trying to practice family-based treatment, or the Maudsley method, and take over feeding me, um, with no guidance. So they didn't know what they were doing, but they were just trying to keep me alive. And it was heartbreaking. They like physically force feeding me. And it was bad. It was very, very bad. And it's like not a time that we like to think about very much because it was just so painful. Um, and I moved back home. I was in, right. I should say I was in an apartment by school, moved back home because I could not be trusted to take care of myself. And they would feed me. And I'd go to school. I did like a schedule of like 2 full days of schools, so I'd go in for the day and come home. And the turning point for me actually was seeing the Orthodox Union's film from many years ago called Hungry to Be Heard about eating disorders in the Jewish community. My dad at the time actually was working at the OU, saw the movie, brought it home. He said he gave it to me with DVD. He's like, whenever you want, maybe even a VHS, like watch this in your own time. I really recommend it. And this was, there I'm making it sound like it all happened at once. This was many months later. But I remember watching it and thinking, oh wait, I'm not like the only one who's struggling with this. And kind of like things clicking that people said. And from that point, I asked for help. And when I asked for help, that does not mean it was like a car wash where I asked for help and then I was ready to get help and then it all was great. It was very much a slow process, from there. But I admitted that I had a problem from actually seeing that movie.
Wow. Wow.
I just want to commend also your parents because, that they're so like emotionally attentive and they were able to really know their daughter and know something was going on. Because unfortunately, as we know also with our clients, they don't have that support. So just for them to really be attuned to your needs is really awesome.
100%. No, I'm very, very grateful that I have the
And
parents
to
I
be
have.
so adamant about it,
Yeah.
I guess it's unfortunate in the way it played itself out,
Yeah.
a desperation and survival,
Yep.
forced itself upon you, and their adamance and insistence, got somewhere at some juncture.
100%. And I mean, I've had clients and been in situations, I speak in schools a lot, where someone will find out that a student, let's just say, is struggling and inform a parent, and the parent will say, literally just say, okay, good, they should lose weight. That why are you calling me and telling me this? And so I do not take for granted that my parents knew it was a problem and took it as a problem. Yeah.
Wow. Okay. Does anybody have any questions? If you do, please raise your hand. And if not, we're going to move on. Okay. Temimah, talk a little bit about treatment. What does that look like? What's gold standard? What's
Right.
protocol? And what was your experience of treatment?
Sure. So there are various levels of treatment, that we've seen in other diagnoses as well, in terms of inpatient, residential, day treatment, IOP, outpatient. Um, I ended up moving through many of those, not all of them, but many of them, over the course of many, many months. I think what's really hard now is that most people who need the support don't have access either because of insurance or because of secrecy, in terms of not wanting anyone else to know. But I did have access, so I'm very grateful. And also many people don't qualify, quote unquote, because again, their bodies don't look a certain way. It's a whole, I could talk for hours about my rant on that. But I did end up getting, excuse me, support. Um, Getting over a sinus infection. I so for me, I ended up going to residential. As the only Orthodox Jew at the time, which many Orthodox Jews will say, although we're seeing a lot more people going for help. Um, and the support at that type of level of care is predominantly behavioral. So really trying to relearn how to eat normally. And again, I say this in a playful way, like not do weird stuff with food, and exercise and have restriction to certain behaviors, restricted access. And there's definitely therapy. There's a lot of therapy. And it's really about getting through the hurdle of unlearning the disordered patterns. And I had a colleague who once said, and I love this, planting the seeds for ongoing outpatient work. So it's really about almost
like how do they generate or cultivate motivation? For whatever reason, people are struggling with the eating disorder. They're so gung-ho motivated to maintain the eating disorder. And here you have behavioral interventions. There seems to be a gap between what I want and what you're trying to get me to do.
So I will say that one of the main things is identifying what is the motivation that someone might have. That can include getting out of treatment to go back to their eating disorder. For some people, that's what gets them through. For some people, it's I don't actually want to fully recover, but I do want to be able to finish school, or I want my marriage to last, or something where it's like just enough. And I always tell my clients, if 0.05% of you wants to be here, then we can work with that. Like just something that can help get you in the door, to change, to work on those behaviors. And, for a lot of people, there was a motivation to not have certain medical interventions like an NG tube, or to have to drink certain supplements or things like that that would help them get through the behavioral aspect while also doing a lot of CBT, I will say, to support these changes, these behavioral changes. Other modalities as well, but I think, CBT or CBTE, there are a lot of evidence-based practices in that realm for eating disorders. And I think sometimes just when you're in an environment where everyone's going through it together, you can gravitate toward the people who are also trying to get away with the sneaky stuff, or you can gravitate toward the people who are like, hey, they're saying life could be better. I don't know if that's true, but you want to try that also, kind of a thing. And so definitely the group practice of support and feeling seen and feeling heard. And I think that it didn't happen at where I went to treatment, but I think in many centers where there are staff who talk about being recovered, that does add a level of like, oh, there's a person here, if not many people here who have gone through this and live a life now, like maybe that is going to help me hold on to motivation too. Yeah.
So I'm hearing you say there's a social component, there's a group support component to being in a center, let's say, or in a.
There can be.
Mhm.
There can be. I mean, listen, also if you use it that way, there are some people who never speak to other people, while they're there and they just keep to themselves. And also, readiness in terms of making those changes is a huge factor for
Yeah,
people.
because we've seen people in treatment centers for so long and they relapse so quickly.
Yes.
What's really going on in your experience? Is it a lack of motivation and interest? Is it a fear of something? Is it that very deep rooted need to get that, in your case, it was the staying young need met, or is getting attention need met, or something?
Yes, to all of the above. It depends on the person. There are a lot of factors that could cause someone to stay stuck. And it happens to be my roommate actually, was someone that was a very similar experience where she would go into treatment, be there for months, leave within a month, need to go back, kind of a thing. I think that for some people, they have not, for a lot of people, actually, underlying traumas that they've experienced have not yet been uh, explored. And that's a very hard thing to do well in terms of treating trauma, which is going to lead someone to use behaviors to cope with the activation and to cope with how out of we'll say the word control that they feel when when talking about trauma. To do both at the same time is very hard, and there are many people who will say, well, first we have to get the person to stability behaviorally, then we'll talk about the trauma. And other people will say, well, we tried that, but actually we need to explore the trauma before we're going to actually work on the eating
Yeah,
disorder.
it's kind of I guess part and parcel of what I'm asking. Is that do we need to really dig deeper, especially for those who are quote unquote treatment resistant, right? Because there's the compulsion and the desperate need to be, like you're saying, in quote unquote control, supersedes anything else.
100%. I think that there needs to be the expectation, though, that that doesn't mean the person will be quote unquote healed when they leave treatment. I think that's where a lot of people get stuck, where they want to unpack, or a lot of clinicians want to unpack, and help the person. And then all of a sudden, let's say insurance cuts or it's something like that. And the person's like, wait, what do you mean? We started unpacking the heaviest theme of my life that I'm terrified of letting go of and also terrified of having forever, and now I have to go home tomorrow, potentially to my abusive environment, kind of a thing. And so I think there's a lot of protection that people have from doing that, whether, it's the client themselves or from even going there in treatment. But I think that when it's stated in terms of the expectation of, like I said, we're going to be planting seeds and starting to unpack what's really going on here. And you're going to continue that with more stability because we're also going to be working on your coping skills and your resourcing while you're here so that you can go out into the world and have different tools than just your eating disorder or self-harm or, whatever it is that the person might be using to cope, oftentimes co-occurring, conditions. So yes, both need to be treated. We're living in a world where the systems make it very hard to do that.
Meaning,
Meaning, having the time and money to be
mm,
in an environment that feels safe to be able to treat both the behaviors and the underlying
mhm.
concerns.
So tell us more about your particular experience through treatment.
Yeah. So, um, I laugh because I didn't know this at the time, but I like got in trouble a lot, but I didn't know I was getting in trouble because I was refusing to do things a lot. So I've actually had clients say to me like, "You're probably like a A+ student in treatment," or and they don't even necessarily know I went to treatment. That's not something I, have always shared. I'm obviously sharing it here. I'm not afraid of that getting out into the world. But I'm like, that's so cute that you think that I was an A+ student, in that environment. I really wasn't very interested. I think that a turning point happened for me when I did find my people, so like I said, sometimes that social aspect was there for me. Um, and also when a therapist, actually an art therapist, made the connection to me, she told me based on something I made, you're so afraid of dying that you're actively challenging death through your eating disorder, thinking you're always going to win. And so far you have, but that doesn't mean you will. Which was, one of those
That's something for
beautiful,
you, yeah.
yeah. So that definitely helped me, like I said, take that and then find a new therapist when I left, and I was doing other levels of care, but then that was the theme I was working through. In addition to, again, like growing up and uh needing to also recognize that people being concerned for me does not mean that it's not the same as care. Now, obviously, if someone's concerned, typically they care about a person. In my mind, though, if someone was not concerned about me, then how did I know they cared about me? I think that was like the youngest child in me in a way. And so that doesn't mean I was like acting out in any other way than my eating disorder, but I think it was a part of me was very afraid of letting go of it because if I let go of it and people think I'm fine, will they still show up in my life? And I learned that the answer is very much yes, and in a way that we could connect way more when they're not like dreading, what I'm going to answer about how I'm struggling and all of that. But I think honestly through the nature of my eating disorder, it was like almost that belief became cemented very quickly of like, well, you can't let go of this because look who's showing up for you, even though I was not accepting. I stopped speaking to most people in my life because I
Mhm.
just didn't have the energy. But they still showed up, which I also am very grateful that I had people who didn't give up on me. And so if I was just like a regular person with no identity, how did I know that people were going to show up for me?
Mm.
So I
And,
did have to learn that.
and what did recovery or resumption of eating look like? Was that in phases? Was it how did that come about?
Yeah. Yeah, definitely a lot of supervision in terms of like being in treatment, definitely in phases. Definitely like started struggling with newer behaviors, which often it's like whack-a-mole, that once you stop one behavior, something else comes in as a means of holding on. I worked with a dietitian. I didn't really listen to anything that dietitian said for a while. Um, and I also like really got away with stuff for a long time. And I remember my sister telling my parents, like, I think you don't realize that she's still doing a lot of things. And they were like, no. And she was like, yeah, they are. My parents don't know anything about like nutrition. Like they just like didn't really understand that when they thought I was, having enough or not doing something that I was definitely doing not the right thing for myself. Um, so it's definitely in phases because it's hard to even answer. There was no turning point of like that year is when I decided I was going to eat quote unquote normally again. I think it was just over time that especially with the practice of treatment and like needing to have supported meals multiple times a day. But I do remember I remember moments of having more freedom. I remember being on a trip actually to Israel that I was only allowed to go on if I could feed myself and not be supervised because my parents continued to supervise me for a long time. And I wanted to go to Israel. I wanted to see my best friends, someone I was dating, which somehow maintained itself through my eating disorder. And so that was motivation for me. And at first I was like, there's no way I'm
Wonderful, so
doing that.
fascinating. I don't know if this was noted, but when you say I wanted to go to Israel and go visit my friends, that's a very not childlike, a very adult, mature stage. And so your parents potentially were able to motivate you by saying, okay, if you're being mature, right, if you're
Yeah.
being adult, then you should be able to feed yourself too, which may have clicked with you and said, hey, if I'm going to Israel, I can feed myself. And that
Yeah.
may have been an interesting transitional point.
100%. That trip, so I know I said there was no moment for the food, but that trip was very, very significant to me. And I actually ended up doing a semester in Israel, like toward the end of school. Um,
Yeah, those who say that when you go to Israel, you grow up, they're just right. See that? Kids have to go to Israel so they can grow up.
listen, it was very healing for me. Also because it was my practice being an adult. I had an apartment in Nachlaot with roommates. I wasn't like on a program somewhere. Like I just had to go and have this like cushioned experience, if you will, of being a grown up. And I think I also, again, over time, really understood logically that as much as I was trying not to grow up, like I said, I was still getting older. I wasn't actually freezing time. So if I'm getting older anyway, almost like why not enjoy life as opposed to being stuck in a way that's not
Well,
actually
it's
keeping me.
interesting because getting older was speeding up your demise, so to say, right? As far as
Yeah.
you're concerned. So the risk or the ambivalence of growing up, going to Israel and growing up, you obviously had something a motivator that was greater than your fear of death or dying.
Yes. Well, and I think because it was really just so it became I think as people were going through different life phases around me and as I just kept getting older on the calendar kind of a thing, it was like, well, it's very nice that I'm stuck, but I'm not. I'm who am I like kind of like who am I kidding? Like I'm still getting older here, so how do I want to live,
You can't
if I'm gonna live?
arrested or paralyzed forever.
Yeah.
Okay, so that realization started growing
Yeah.
on. Okay, let's take a question from Shulam. Go ahead. One of our
Hi.
great contributors.
Thank you for sharing all this. I'm hearing that the behavioral part is very big, and there's also dealing with traumas to make it stay, to make it right, things like that. And also, what about family involvement? Because what I'm hearing is that they get involved in terms of making sure the person is adhering to treatment, that's important, or getting them into treatment, showing concern. Is there room for more? I know some people do a lot of family therapy, and I've heard some negative reviews about it too. So, what do you heard from you as well? I heard something negative about it.
So I think, first of all, I've definitely worked with clients where no one in their life, literally not a single person besides maybe their medical doctor who has an inkling, knows what's going on. So it very much varies in terms of the level of support. I think, like, we know for any client with any struggle, um, we like to say, secrets keep you sick. And so within this context, the more support, the better. There is family-based treatment, which is a very modulated type of treatment, typically for adolescents, although it doesn't have to be, but typically for adolescents struggling with anorexia, where the parents are involved in a multi-phase process to helping them, the client, sort of relearn how to eat and also have more independence. A lot of people, when the parents become the treatment team, there are many people where it works beautifully, and there are many people who they don't want their parents to be the ones, in charge of their meals. They want a therapist or someone else to do it if they want anybody. Um,
Well,
Oftentimes,
I know where Shulam was going with this. You're going with family therapy because we know Salvador Minuchin treated eating disorders using family therapy, and he was a rock star. I mean, he did
Yeah,
the
but even him, he had a lot of behavioral stuff happening in the background and medical stuff. So this is just one part of it to address the family dynamics, as far as I know.
yeah, he was just
So,
a family
but
man.
yeah.
So when I, work with clients, first, I will say this with adolescents, it's in treatment centers, it is required. The family has to come in for, or virtually, be there for therapy. Um, Much of the time, learned behaviors surrounding expectations, and we haven't even touched on this as a whole, which is really important, diet culture and the culture we have around the pursuit of weight loss to try to recover from any eating disorder and live in the world we live in is extremely, extremely difficult. I think more so than I don't want to say that actually. I shouldn't say more so, but I think that when you're recovering from something that everyone agrees is a problem, people want to support you. When someone recovers from an eating disorder and they are learning to embrace their body wherever it falls when they recover, to have everyone around them being on GLP-1s and, like trying to pursue weight loss feels confusing and very difficult. And so sometimes it is very important to have the family come in to address their relationship to food. And of course, the underlying, concerns that have contributed in terms of more the thematic and the mental health. But family sometimes comes in because we need to talk about what are the eating habits of the family as the person is trying to recover. Again, that's one side, it's the behavioral side, but that can actually be a major obstacle, for people to move forward because they're doing everything they can, and then someone's making a comment of like, "Are you really going to eat that?" When all they've done all week is try to gear up toward eating something or not eating something, or in terms of, let's say, binging, kind of a thing. Um, so family is often involved in that way, and it's not surface, but I think you hear what I'm saying. Like it's surface in the behavioral sense, but then there's the underlying emotional, which can be the way that weight can be tied to self-worth for so many people. And then we get into also the family dynamics that may have contributed toward the person's struggle, that need to be addressed.
Mhm.
That's such an interesting point that you made earlier about the surrounding people wanting to be just like you when they're trying to support you to get better. And then when they finally get there, they have people supporting them to get better because it becomes an eating disorder. The whole perpetuation of like, I'm jealous of you that you're so thin and that you look so good, or you're able to do it, or whatever that jealousy might be. And then suddenly, when you get there, you realize you're at the bottom and have to climb back up. It's very confusing.
It's very confusing, and again, so we're talking a lot about restriction. There's also, of course, binging, purging, exercise compulsion, many, many different types of behaviors. We live in a world that unfortunately so overvalues something that shouldn't be a value, which is how we look, and so it's just, to me, it's heartbreaking, that someone will be in recovery from an eating disorder of any kind and go out to, let's just use the context of, a community, go out to like a Shabbos meal, Shabbat meal, and everyone's talking about what diet they're on and how amazing things are and what they're not eating, what they are eating, and that is that person's whole life. And there's a question that a lot of people have of, well, why should I bother recovering? Everyone else is talking about this anyway. And I have people, I eat something and my therapist tells me that that was a behavior, but the person just said they ate the same thing. So what's the point of me even doing this? Because this is just the world we live in at this point.
Okay. Let's take a question from Mickey again. Go ahead.
Yeah, so it's interesting that you brought that up, the whole diet culture, because I mean, us Jewish women, or even women in general, the first thing that we actually do, and I spoke to someone who um, I've connected with and work with. I'm sure you've heard of her, Marcy Forta from
Sure.
Atmi.
So I'm on the board of Atsumi. Yeah.
Oh, nice.
And she was on the show a few months ago.
Yes. So it's like, oh, you look so good. You look so pretty in your dress. And it's like the first thing we notice is like the weight, how we look in something. And I try really hard not to do that. But like, what was your reaction to yourself? Like, I'm assuming you're a mom, and like pregnancy and just postpartum and just trying to get back to yourself after all of these transitions. And I can tell you, like, it's still an ongoing struggle. What would you say with your own recovery and your own journey? Like, how did you work through that, going through all your challenges, to begin with?
Yeah. So I the like statement of like going back to myself doesn't exist in my brain. My body goes where it goes, kind of a thing. So So I will say this, I am recovered. I am not in recovery from an eating disorder. And this, there's a debate in the field, are you ever fully recovered? There's a lot of debate as an addiction. I say no, it's different than an addiction. Like, there's a split. But I use the language I'm recovered. I do not have an eating disorder. I have not for many, many years. And I actually think my relationship with my body is probably better than most people I know because I went through this and recovered in the sense that I really it's very neutral to me. Now, we live in the world we live in. I'm not an ostrich. My head is not in the sand, like, but so if I have a thought about my body, my second thought is always, oh, there's like diet culture having an influence in this very, like implicit way. So there's no effort. I have not made an effort to change anything about my body in so many years. It's really, and I will say also that there's a level of privilege that I have. I'm what we call straight size. I can go to a regular clothing store and buy the clothes. So that does give me privilege in that sense. I fully own that, and don't minimize that. But I really think my relationship with my body is so much better than most people I know because I feed myself and I'm very in touch with my hunger and my fullness and I sometimes eat emotionally and that's very normal. We used to be in the field that we would say like, no, like you only eat when you're hungry and you stop when you're full. It's like, no, we're human beings. We eat emotionally. Um, but it's just not something I take much time thinking too much about, to be totally honest.
And what would you say to a mom who like, with like a child when it has to do with like an healthy relationship with food? I'm hungry for this, but I want applesauce or dessert. I'm like, okay, well, if your tummy is full for this, then you can't have that. Trying not to restrict, but also kind of like give them those, you know.
Yeah. So I would say the best thing is to look into the concept of division of responsibility within intuitive eating, which is a book, the intuitive eating book, to learn more about like your role as a mom. And also, I mean, this could be a whole other discussion in terms of, like how to promote a healthy relationship to our bodies and to food. But really it's like not making food off limits, but you're still the one in charge and not ever using labels of food of like this is good or bad or choose a healthy option, um, and helping kids learn about their relationship to food, but not doing so in a way that includes a lot of rules is like the best sort of short answer I can give to that. And again, there's a lot of nuance in the sense I can give examples, but it's a whole it's a whole topic.
Wow. Okay. Well, Tamima, I want to thank you so much for doing this. This is so courageous,
Oh,
so beautiful the way you describe your process and with such grace.
thank you.
And it's really, really appreciated. I'm sure this is going to help many, many, both professionals and non-professionals alike.
Thank you so
I
much.
thank you for that and being so gracious about it.
Thank you. Yeah, and if people have questions or want to know more, so if you look at my name right now in my box, right, Temimah Zucker, I got very lucky. My website is literally just my first name, Temimah.com. I put in
Wow.
that.
You
I
sell that
know.
for a lot of money.
I my husband literally looked it up the other week. He was like, I wonder how much